This video will describe the administration of the modified tuck jump assessment. So the tuck jump assessment is a clinical-friendly screening tool that was designed to support practitioners with identification of neuromuscular deficits associated with ACL injury. The test lasts 10 seconds where the athlete repeatedly jumps into a tucked position without any pauses in between. At the discretion of the practitioner, to standardize it better, you can use tape to tape a box on the floor at 41 centimeters by 35 centimeters and having the athlete put one foot on either side of the 41 centimeter strip from side to side. The outcome is tuck jump scoring from 0 to 20. You can see the criteria here. If the athlete failed to meet the item criteria on 2 or more attempts or repetitions, then they would be scored a 1 or 2. A passing criteria would be less than 6 out of the 20 total possible points, so a lower score is more advantageous. So here's a chart that is provided by Meyer et al. In 2017. Each of the 10 criteria are scored from 0 to 2, and there's a scaled system for each of the criteria. For instance, if we look at the first criteria, lower extremity valgus landing, no valgus for 0, partial or mild valgus for 1, and then more dramatic valgus for scoring of 2. Again, the higher score shows to be less advantageous and more neuromuscular deficits. Here's a written chart of that same criteria for each of the 10 criteria. You can see those listed in the second column, and they have categorized the different criteria by knee and thigh motion, foot position during landing, and plyometric technique. It also suggests the different views that you can see it from, either front and or lateral, that is from the side. I'd encourage you to take some time and practice the assessment, as well as familiarizing yourself with the criteria prior to actually performing it. Another suggestion would be to film the tuck jump assessment in the frontal and sagittal planes with your most available mobile device. In summary, the tuck jump assessment is used to identify neuromuscular imbalances that may provide direction for targeted treatment for those at high risk of ACL injury. Improvement in neuromuscular techniques may be assessed and continually monitored with repeated measures using the tuck jump assessment. Multiple factors may underlie the differences in ACL injury risks between males and females. Neuromuscular control, being said, may be one of the most important modifiable factors that can be addressed with strategic and structured plyometric training regimens. If you have any comments, questions, or concerns about the assessment or this presentation, feel free to leave them in the comment section below. I'm also happy to provide a check sheet if necessary, if you're interested in performing the tuck jump assessment within your clinical setting. Here are my references, and feel free to look them up as they give further detail about the reliability and psychometric properties of the test.